Unfortunately, we don't have a choice in this state. When Brook Run was closed, the dental clinic which we used then was shut down, and I was left hanging until I heard about the DDD group here.
We never would have imagined that we would have seen or had a need to see as many people as we've currently seen. The DDD Foundation is a nonprofit organization committed to providing comprehensive oral health care and education to patients with developmental disabilities. Because mainstream providers are often reluctant and/or improperly trained to treat patients with severe disabilities, the DDD Foundation Dental Clinic fills a major gap in available services to this special population. Staffed by a team of clinical and administrative professionals trained to serve patients with developmental disabilities. The dental clinic provides routine, preventive, and emergency dental care, including extractions, fillings, cleanings, x-rays, intravenous sedation, and same-day surgery. Because of limited funding, the clinic has been unable to accommodate its growing needs. The dental clinic averages a budget shortfall of $139 per patient. This shortfall is the difference between the clinic's standard initial treatment fees of $618 for an exam, cleaning, x-rays, and sedation, and Medicaid reimbursement rates of $479. The way the gap is filled is through fundraising from special events and contributions from foundations and individuals.
I think it's so neat when somebody takes his or her time to make such a difference in the life of a child. And these are children who really, really need the care and find it so hard to get the care.
Very personally, my son has cerebral palsy, and which happened at birth. So having a child with a developmental disability has been extremely impactful in my life and in his, in trying to find services for him.
The DDD Foundation is unique in that it provides a service to patients with disabilities. It's one of the only ones in the state and even beyond the state. And so it's providing a service for people who would ordinarily not have dental care.
I first learned about the dentistry for the developmentally disabled through another dentist's office that didn't cater to the needs of those that were medically fragile. This facility actually not only provided a resource for him, but it also provided staff that had a foreknowledge of the needs medically in addition to the dental services that he would need. And that was like a load off for me that really meant a lot.
The dentists here seem to be aware of the special needs of children with disabilities, and they're easy. They help me get them in and out of the chair, help me get them in and out of the car. Most dentists don't do that kind of thing. And they're real patient with them, you know, trying to get them relaxed enough to go through the procedure. And it's just great. They just really seem to enjoy what they're doing.
Matthew was about 7 or 8 years old, so he was still a little guy, and we were nervous coming, as you are, with a first experience with your child. And I was amazed, though, when he was first wrapped in sort of a papoose to keep him restrained, at how much at ease he felt and how the staff really made him very comfortable and essentially made me feel comfortable.
They are really, truly people from the heart. And so what you get is just honesty from these patients and from their parents as well. Sometimes it's good, sometimes it may not be as good in terms of what they're feeling, but you have to understand their stress and the things that they go through. And so it just makes you very grateful, and actually I look at it as a privilege.
It's my daughter who is currently under my care, and I have had her to come over to the DDD Foundation here about 2 to 3 times a year, I guess it is, for her care of her dental problems, and she has had problems. She's losing her teeth, unfortunately, and these people have done a beautiful job in trying to save what we have going for us. My son was also under the DDD Foundation care. His situation was certainly different, but the main thing I want to get across is that this service that is being performed by Dr. Redino and her staff is desperately needed to maintain the dental oral hygiene type care for these very special people.
And one thing that is sad, but yet still is true, that the population is getting larger, and that's the way it's going to be, and they're going to need somewhere to go. And now we have people coming from everywhere. We'll have something to give them, something to offer them that's going to really make a difference. They will really benefit from it, as well as the community.
I was always taught that your life is only worthwhile if you use your life to benefit others.
Over the years, I have given out many cards to friends and people that I just meet at doctors' offices who are saying they're looking for a dentist, and everybody that comes here says the same thing, that it's a great place and they feel so comfortable.
Anything you would like to say?
No.
Okay. I would also like to say that it has given Lolan back his smile that I am so thankful for. You know, he has that smile, he has that confident smile again. So that's what I'm really grateful for.
For more information or to make a donation, you may contact us at DDD Foundation Incorporated, 52 Executive Park South, Suite 5203, Atlanta, Georgia 30329, or call 404-942-0086, or you may visit our website at www.dddfoundation.org.